It's time to take 5. Now you know.
We're visiting St. Mary's Medical Center, a Palm Beach Health Network hospital. Today we're speaking with board-certified orthopedic surgeon Dr. Tom Minas about cartilage repair and joint preservation of the knee. Doctor, you are a board-certified orthopedic surgeon. Tell us about some of the disorders you treat.
So I treat injuries to the knee, and that's pretty much any injury to the knee. So these are sports-related injuries or degenerative conditions of the knee, and that involves the use of arthroscopic surgery to clean up the knee, to do meniscal repairs, to do ACL reconstructions, and my specialty is in cartilage repair. So the holy grail of the knee is the articular cartilage on the end of the thigh bone and the shin bone, and that was thought not to be able to be regenerated and treated, but we have excellent specialized techniques that reproducibly repair that and give excellent clinical results. If that goes on to break down over time and people have degenerative arthritic knees that are painful and it's too far for cartilage repair, I also do custom printed knee replacements and even do this in our very young population of those under the age of 50.
You are performing Macy to help repair cartilage for the knee joint. What is the procedure and how is it performed?
In the late 80s, I was doing research to see if we could regenerate articular cartilage because at that time it was thought to be something that could not be done. And there were scientists in Boston that were able to culture cells and have them grow. And we did work to determine that this was actually possible. And I found about a Swede who was doing this in people in Gothenburg, Sweden, Dr. Lars Peterson. And I visited him in 1994 in Sweden and brought ACI, autologous chondrocyte implantation, to the United States in 1994 and did my first clinical patient in 1995, and since then over 1,000 patients and continue to do them as time goes on. We've had 3 generations of ACI, autologous chondrocyte implant. The first time it was done was with a cover that was from the patient's own bone, and the second time we did it, the second generation was using collagen, and the third generation now, the Macy or the matrix autologous chondrocyte implantation, we grow the cells through collagen and then reimplant them in the knee. So there's 3 generations of ACI that I've been involved in.
What are some of the benefits of Macy over other knee repair options?
Because the cells are grown with the patient's own tissue through a collagen membrane that is bioabsorbable, can still be implanted into somebody's knee much less invasive than the earlier generations where we had to open the knee quite a large way in order to sew the tissue into the joint. Here we can glue the tissue into the joint or just use a few tacking sutures to hold it in place. But we always have to look at what we call the cause of the cartilage damage or the background factors, and often have to do other surgeries with the Macy in about half of our patients.
Many conditions, if left untreated, can become increasingly painful and even dangerous. What advice do you have for patients who may have pain or discomfort but are delaying care out of a fear of coming to the hospital?
Well, many patients have the philosophy, being athletes, no pain, no gain. Well, that refers really to the muscles. When you work out and you have soreness in your muscles, that's okay. But joint pain is not okay. Your knees and your shoulders and your elbows and your hips, they're meant to function in a frictionless environment where there is no pain and they move well and smoothly. So if you are having joint pain when you exercise or swelling or grinding, you should not push through that because you will damage your joint and develop a premature arthritic knee joint, which of course can be very problematic.
Why should a patient choose St. Mary's Medical Center?
We have excellent care for our patients, and it's really a professional act and great clinical outcomes for our patients.
Thank you, Dr. Minas, for all of this helpful information. We hope everyone understands it's important to take care of your health, and if you need surgery, please don't hesitate to go to the hospital. The doctors, nurses, and staff at St. Mary's Medical Center are there to keep you healthy and safe.